Let's stop pretending we do not know what is happening. American healthcare did not break overnight. It was re-engineered, not around patients, not around clinicians, around revenue, risk management, and operational control. We built a system where time with patients is compressed, documentation is expanded, metrics multiply, and the people that are doing the work are expected to absorb the consequences. We call it efficiency, but let's be precise. It is throughput at the expense of judgment. Clinicians are no longer operating in environments designed for care. They are operating in environments designed for predictability, scalability, and financial performance. And those three things do not always align with human reality. You can feel it on the floor. You see it in delayed care, rushed interactions, preventable complications, and quiet disengagement. Not because people stopped caring, because they were asked to function inside systems that do not support how care actually works. Let's talk about the workforce. We have professionals who recognize risk early, question unsafe conditions, and carry real-world clinical awareness. And instead of being centered, they are often filtered, redirected, or pushed to adapt to systems that prioritize consistency over complexity. Not because they are wrong, because they do not fit neatly into models built for control. This is not about blaming corporations as villains. It's about acknowledging a reality. When healthcare is structured like an industry first and a human system second, you get misalignment. And misalignment at this scale creates burnout, turnover, and instability, not as side effects, but as predictable outcomes. Here's the part that matters most. Healthcare does not collapse all at once. It erodes quietly. A missed detail here, a delayed response there, a clinician who stops speaking up, a team that normalizes what used to feel wrong. And over time, the system still looks functional from the outside. But inside, it's running on people holding it together with less and less support. This is where we are. And this is where we make a decision. Do we continue building systems that rely on human endurance to compensate for structural gaps? Or do we realign healthcare around clinical judgment, workforce protection, and patient-centered reality? Because here is the truth no one can afford to ignore. You cannot build patient safety on top of clinical and clinician depletion. You cannot scale care by stripping away the conditions that make good decisions possible. And you cannot expect long-term stability from a workforce that is quietly disengaging. This is not only a nursing issue. It is an EMS issue. It is a respiratory issue. It's a pharmacy issue. It is a system issue. And systems do not correct themselves. People correct them. When enough people name what is happening accurately, they stop internalizing structural failure and begin aligning across roles. The narrative shifts. And when the narrative shifts, so does the system. Because healthcare was never meant to function by consuming the people who sustain it.